Well, welcome back, and let's talk about patient assessment. In this section, we're going to go over what the EMT's job is with patient assessment and how patient assessment for Barton Community College, how we've taught patient assessment for the basis of making sure that you as a student understand how to provide patient care and how to do your assessment. So, number one, what are some scene hazards that you might come across when you're encountering your scene size up? So scene size up doesn't stop when you hit the door and that's it. It doesn't stop until you get back to the station is when scene size up stops. It starts at the station and it stops at the station because we're constantly scanning the scene and making sure that we're being aware of any hazards. That could be dogs, cats, violent criminals, Batman, Superman, whoever, whatever. We need to be ready for different scene hazards, from hazmat incidents to violent criminals to even the baby crying in the back bedroom that we might need to care for because of the sick mother in the front room. Number two, what does one, I'm number one stand for, and why is it important? Because one, I'm number one stands for my scene safety. My safety, I'm number one. I'm concerned about myself, then my partner, then the bystanders, then the patient. So one, I'm number one, and it's important because you need to make sure that you've got your BSI on and that you are making sure the scene is safe. Not that you're asking if the scene is safe. You are deciding if the scene is safe. Number two, what's wrong with you? What does it stand for? You got to ask, what's going on? Why did we get called here today? What's your chief complaint? What's going on? What's wrong with you? And we need to look at all the different things that are going on. How are they presenting? What's our general impression of this patient? Why did they call us here today? What are we seeing when we walk up to them? 3, LOC covers our ability to determine how responsive they are. What's their level of consciousness? LOC stands for level of consciousness, and it's important because we need to determine if they're alert, if they're orientated, and if they're not alert, are they alert to verbal stimuli? Are they alert to painful stimuli? Are they unresponsive? And we need to be able to determine this, and so we need to ask questions to figure out what's going on. How do you perform AVPU? Well, what does AVPU mean? Well, it's what I just talked about, the alert, verbal, painful, unresponsive. And so when you're doing verbal, you need to use some type of verbal phrase. Hey, are you okay? Painful, we need to use some type of painful response, from a sternum rub to maybe pinching the shoulder, pinching the finger, to see if we elicit a pain response or if they're completely unresponsive. Any more means we need to decide, do we need any more resources or do we have any more patients? And this is important because we need to decide, do we need to call the hazmat team? Do we need to call the fire department? Do we have 4 or 5 patients that get out of our immediacy of taking care of these patients and we need to call in extra units to transport these individuals? And so what are some examples of additional resources? And so we think about, from just fire departments to maybe the dog catcher, to an individual who is involved with babysitting. We need to call grandma to come babysit the child who's in the back bedroom, and she's going to be an additional resource. So you got to think about things a little outside the box when we talk about patient assessment. 5, finally, in our scene size up, number 5, C-spine. What is C-spine? C-spine is holding that head nice and straight and making sure that they don't move, so we're protecting the neck from any possible injuries. Doesn't mean that we're going to prevent any injuries from happening, but we're reminding them not to move their neck. Now, in regards to the number of patients that we're dealing with, the definition of multiple casualty incident is when we have an incident that requires resources because we're overwhelmed by the number and severity of casualties. This is when it overwhelms the resources available in the area. For instance, if you're in a small rural area and you only have 2 ambulances, it's not going to take much to become a multiple casualty incident. However, if you're in a large metropolitan area, it's going to take a lot larger number of individuals to start overwhelming the system. And so a multiple casualty incident deals with the number of individuals and severity of casualties that start overwhelming the system. And exsanguination begins with our life threats, X, A, B, C, D, E. Exsanguination is life-threatening bleeding that we need to stop immediately by applying direct pressure or a tourniquet. When we talk about airway maintenance, when we talk about airway, it's about keeping the airway open and patent. And the 4 things we need to remember when we're checking primary breathing is that the breathing is present. How are they breathing? Are they breathing regular? Are they breathing labored? Are they breathing shallow? Do they have equal chest rise and fall? What are their lung sounds? And then what's their oxygen saturation, so we can determine how much oxygen do we need to provide to this individual. And then we make it to C of X, A, B, C, D, E, and C stands for circulation. And the 3 things we want to be checking here are blood sweep, making sure that we go head to toe looking for any further bleeding, but not as life-threatening. We also want to make sure that we're dealing with the skin color, temp, and condition, as well as checking the pulse. And we're just checking pulse for the, is it regular or irregular, and is it strong or weak. And so color, temp, and condition refers to the skin and how we check the skin. And then we finally finish out the primary assessment area by doing the different triage colors, where green is going to be our stable patients, yellow is going to be our stable but potentially unstable, red is going to be our unstable patients, and blue is going to be code blue, cardiac arrest, respiratory arrest. Then we moved into how do you determine those is just based on if they're stable, potentially unstable, or in cardiac arrest. And if they're code black, that is death, and that's when we call the coroner. Chief complaint is what the patient tells you, and they say, this is what is wrong with me. I'm having difficulty breathing. I'm having chest pain. They may be having something completely else going on, but their chief complaint is what they're telling you. History of present illness is their history of what's going on of the present illness today. So if you have a condition that you're presenting with chest pain, how long has this chest pain been going on? When did it start? Everything related to that chest pain. And then on the opposite side, past medical history is everything before the incident that has occurred. So if you broke your arm 3 years ago, if you had a heart attack 5 years ago, et cetera, et cetera. So past medical history is the history in the past of your medical problems, and the history of present illness is what has brought us to today with you having your illness today. What has culminated to this point of this present illness. And that finishes out the patient assessment portion and brings us to get ready to start the medical overview. So stay tuned to go through the medical overview, and then that leads us right into doing our medical emergencies.